Hello, hello, hello. Welcome to Wellness Wednesday with Dr. Latoya Wells. I am so glad that you're here for another episode of Wellness Wednesday. We are going to continue with our discussion on kidney health. March is a month where there's many different health conditions that are highlighted or talked about, or awareness that's being made to those different health conditions. But we started our discussion last week on kidney health, and I gave a overall general overview of the kidneys and things of that nature. So tonight I want to dive into a little bit more of the kidneys. So thank you all for being here. I am Dr. Latoya Wells with Wells Legacy Health and Wellness, owner and founder of Wells Legacy Health and Wellness. I am a family nurse practitioner who holds a Doctor of Nursing practice degree. I want to welcome all of our new followers on Facebook. If you're following us on Facebook, go ahead on over to Instagram if you're there, TikTok, and YouTube, and follow us on YouTube, TikTok, and Instagram. I'm grateful that you're here. You could have chosen any other pages to connect with, but you chose Wells Legacy Health and Wellness. So I'm grateful. And I hope that the information that I am providing to you all each and every week is helpful. I do want to pause one moment and just talk about a question that I received last week. And I went back and read it, and it did not necessarily say what I thought it said. So I want to address that question. We were talking about the lower um, urinary tract and urinary tract infections. And there was a viewer, and I also got an email, DM about this same topic. They wanted to know if orgasms cause urinary tract infections. And while the female genitalia, the female organs are really compact, the bladder is very close to the vaginal canal, and there can be some friction that could cause cystitis or inflammation or irritation of the bladder. And if there's certain criteria, if the environment is just right, that individual can in turn develop a urinary tract infection. So I wanted to address that. What are some things that we can do as women to prevent that from happening? One, you can get into the practice or habit of urinating before sexual intercourse and urinating after, making sure you're drinking plenty of fluids, practicing good hygiene, things of that nature. And even with all of those things that can be put into place, some women still develop urinary tract infections after being intimate and having sexual intercourse. And so at that point, there are different things that your healthcare provider can talk with you about. Some women go on prophylactic or preventative antibiotics prior to having sexual intercourse. There's so many different things that can be done to help with that. So if you have more questions, let's talk or reach out to your healthcare provider. But we are available to answer those questions. So I wanted to highlight that and just kind of touch on that topic to make sure that I answered that question, because I had two people to reach out to me about it. So there goes. So tonight we're going to delve into the kidney health a little bit more. Last week we talked about just a general overview, but I want you guys to know I love statistics and I love stats about kidney health. According to the National Kidney Foundation, approximately 37 million adults in the United States are estimated to have chronic kidney disease. Kidney disease is the ninth leading cause of death in the United States. And we talked a little bit about what that looks like, what the kidneys do, how they function. I also mentioned make sure you know what your labs are. I want to highlight some of the labs that should be drawn if you are an individual who, when you're going to get your blood work, just any normal laboratory draws, orders, you should have these three and even some more if you do have some kidney issues. One, serum creatinine. The levels where we look at normal, it should be 0.6 to 1.2 milligrams per deciliter. So that's the serum creatinine. If it's greater than 1.2, we need to look and see what's going on. The next one is the blood urea nitrogen, or BUN. The normal range for that is 7 to 20 milligrams per deciliter. The next one is the glomerular filtration rate, or the GFR, and that one should be above 90 milliliters to be considered normal. I had a conversation with a colleague and really good friend, sister almost, I would call her. She is a kidney specialist, and hopefully we'll be able to mesh our calendars together, link up, and get her on a live this month for National Health Kidney Function Month, National Kidney Month. And so she and I were talking, and there was some controversy that for years around the GFR and the levels when we look at individuals for transplant. And so we had a really good conversation about that, and that just sparked me. Hey, can you come on and talk to us about this? So hopefully we can link up our schedules and get her on. The next thing that I want to talk about is signs and symptoms of kidney disease. We talked a little bit last week about what these signs and symptoms are, but I wanted to get more detailed and a little bit more specific. So being consistently and constantly, persistently tired or fatigued, swelling in the ankles, the feet, the hands. The urine, oddly enough, could be foamy or bubbly in its appearance. We could notice some blood in the urine, frequent urination, especially at night, high blood pressure, and then changes in the color or the volume of the urine. Now, if you're anything like me, you're saying, well, these symptoms can also be signs of other things. And that's true. That's actually true. However, when we are looking at a combination of signs and symptoms, when we're looking at blood work and the results of that blood work, and there's some abnormalities combined with one or more of these symptoms, then it would lead us to say, okay, we need to take a closer look at the kidneys. Also, if you have diabetes, as we mentioned earlier, if you have an autoimmune disorder, could place you at a higher risk for developing chronic kidney disease or kidney disease in general. So those are just some of the risk factors, and those were the signs and symptoms. The risk factors is one, diabetes. I got a little bit ahead of myself. Diabetes, high blood pressure, a family history of kidney disease. And this is why it's so important to know your family history. Have those questions. Talk to those elders in your family. Talk to your mom, your dad. Get that family history, because it's going to let us know if these things are popping up on your blood work as abnormal and you're showing some of these signs and symptoms and you have a family history, then we can say, okay, there's a high probability that we may be looking at some type of kidney disease. Being over the age of 60, obesity, smoking, and cardiovascular disease. And we talked about that. Last week, we talked about the high blood pressure and how that impacts the blood vessels leading to the vital organs, including the kidneys, and diabetes, and how that damages the blood vessels that leads to the vital organs, including the kidneys. And so when do you seek treatment? If you're having any of these symptoms, if blood work is showing up abnormal, if you have a presence of blood in your urine, and let me stop here. Many times, until it's, higher stage of kidney disease, right? Or if you have a really bad infection of the kidneys, you're not going to actually see blood in the urine. Some people do, some individuals do. But when we begin to see the presence of blood in the urine, something is going on. And so women who are of the age of having menstruation, of course, you're going to see blood in the urine, right? But if you're not on your cycle and it's not your menstrual period, that time frame, and you're seeing blood in the urine, something is going on. So I want to throw in that caveat, because I've had people call me, I noticed blood in my urine. And then when I start asking the questions, oh yeah, so we can rule that out. But high blood pressure that's difficult to control can cause problems with the kidneys. History of diabetes or other chronic conditions can affect the kidneys. as I mentioned earlier, lupus or some of the autoimmune disorders, individuals who have persistent symptoms such as being really tired or fatigued, swelling, and changes in the urine pattern are all signs that you need to seek treatment, right? Last week, we talked a little bit about how do we take care of our kidneys. We want to make sure that we're staying hydrated, making sure you're drinking plenty of fluids throughout the day, water throughout the day, can help promote healthy kidney functioning, and it can also help to flush out those toxins. We talked about avoiding the sodas and the things like that, right? Because those things can cause you to have issues or can put a lot of stress on the kidney, so to speak. Next thing is to maintain a healthy diet. Focus on a balanced diet rich in fruits, veggies, whole grains, lean protein. And when I talk about lean protein, I know I shared the My Plate Planner with you all here. And protein should be no bigger than the size of the palm of your hand. And, my hand I would consider my hands to be pretty big, but it's also proportionate to my body. So my portion may look a little different from yours versus someone who, has a much larger or smaller frame. So in keeping in mind with the healthy portions and healthy diet, when we talk about proteins, I always want to put that in your mind. Just kind of think of that. Limit the intake of processed foods and sodium and sugar. One, make sure you're managing your blood pressure regularly and that you're following up if the blood pressure is consistently high, or even if you're on medication for your blood pressure, we still want to routinely check your kidney functioning, make sure your heart is good, all those things, right? Making sure you're controlling your blood sugar if you are a diabetic. So individuals with diabetes, keeping the blood sugar levels under control is essential to preventing kidney damage. Now, we talked about diabetes in the past. Diabetes is a progressive disorder. And so when we think of progressive, it means the longer you have it, the more impact it can have on the body in a negative sense. There's many things that we can do to control diabetes, and there's things that can be done to actually reverse diabetes. But once the damage is done, it's kind of hard to reverse those things. So managing your diet, exercising, minimizing or decreasing the amounts of sugar that you're taking in, losing weight, have all been positive aspects that positive things that individuals can do that can help decrease their blood sugars, their A1C, and they can come off medication, including high blood pressure medication, diabetic medications, and do well. So there's so many different things that we can do when we talk about diabetes and its impact on the body. The next thing I want to talk about is exercising. We talked about that a little bit just now when we were discussing diabetes. So physical activity, it promotes overall health. It reduces the risk for obesity and other related conditions. So we know when there's excess fat that holds on to cortisol, it increases stress on the body, the heart, the lungs, the joints, and it puts you at a higher risk for developing high blood pressure, certain cancers, diabetes. Avoiding smoking and limiting alcohol. We talked about that a little bit last week. I'm not saying that you can't have it. However, we want to make sure that we're living healthy, and healthy living does not include alcohol at a higher amount, all things in moderation, and quitting smoking. Smoking just puts us at risk for so many different things. And so we want to make sure, one, we're avoiding smoking and we're limiting alcohol. Not saying that you can't have alcohol, but just in moderation. The next thing that I wanted to touch on is regular health checkups. So making sure that you're scheduling your physical exam. Everybody should have a wellness exam, a physical exam every year. And to make sure that you're staying in line with the health guidelines, We want to make sure that you are following up with your healthcare providers on a routine basis to make sure that you are getting all the screenings, all the checks, testing, following up on labs and things of that nature, because it's so important. And as we continue with this highlight or awareness with National Kidney Health Month, I want to take a moment just to remember those who have lost their lives to kidney disease. I want to make sure that we're considering those who are on the list for transplant, and think about your status when it comes to organ donation. There are so many individuals who are on lists and have been on lists for a long time for organs, and kidneys are one of the ones that, is, as we mentioned, there's like 37 million individuals with chronic kidney disease who will likely need a kidney transplant at some point in their life. I can say that I have 2 aunts who had to have kidney transplantation, and that was a big task to get them on that list for transplantation. And I've had friends who have been on the transplant list and have gotten kidneys, and I know people who it was too late for them to get their kidney. I can vividly remember receiving a call from a friend that one of our mutual friends got the call that her name came up on the list and she received her kidney. And so we can do so much to help individuals, and just being aware of what to look for in ourselves, and also in our family, our friends, knowing what to look for when it comes to kidney transplants. And so it is so important that we do our job to take care of ourselves, and that we know what's going on with our bodies. If anything, we should know our bodies better than anybody else. And when something is abnormal, when something is not right, we know what to do and know who to call. And so as we continue this discussion on National Kidney Health Month, I want to make sure that you all know what to look for, what to do, when to seek treatment, what signs and symptoms can be directly linked to kidney health. And so we're not going to be here long tonight. I just wanted to hop on and just say thank you all so much for being here. If you have any questions, any concerns, if you do not have a healthcare provider and you are in need of care, Wells Legacy Health and Wellness is here to provide that care for you and make sure that you get what you need to take care of yourself. Our mission is to ensure that our patients, our family, our friends, and our community have the information and the knowledge that they need to be an advocate for themselves, because we need to be able to advocate for ourselves or have someone else to advocate for us when we don't know what to do or what to say. Having someone at your side to help guide you and direct you is so important. To be there, to be your voice in the instance that you can't speak for yourself. So on that topic, how many of us have our living wills? How many of us have our healthcare surrogates? There's something called the 5 wishes that can be downloaded and filled out, where you can write out your needs and your wishes in the event that you get to a point where you're no longer able to speak for yourself. I have my 5 wishes completed. We're working on getting our living will and our healthcare surrogate and all the wills and trusts in place. And that's something that I advocate for as well. Do your family members know what you want? It's time to have those conversations. And so we think we're going to live forever. We think we're going to be healthy forever. And that's the hope, right? That we are all healthy, physically, mentally, spiritually, all around. However, things do happen, and we need to make sure that we know how to take care of ourselves. And if we're at a place where we can't take care of ourselves, that we've designated someone who can do that for us. And so we're going to go ahead and end tonight. This has been another amazing week with Wells Legacy Health and Wellness, and I'm just amazed at the people that are following the pages and sending the messages and liking and sharing their feedback. Continue to do that, because we want to make sure that, again, we're not being repetitive, and I'm not just coming on here talking, but that I am providing information that is relevant and that can help make a difference in your life or the life of someone else. And so I'm grateful to be here with you, and I'm grateful that I have this opportunity in this platform to share my heart when it comes to healthcare, because that's who I am. I'm an educator. I want to make sure that people that I know, even don't know, have the information that they need regarding their health. So take care, stay safe, and be well. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. Until next time, we'll see you later. Bye.